Hi, welcome to another episode of Seco Direct. I'm your host, Dr. Tiwa, and today we are going to dissect the relationship between diabetes and how it affects your kidneys. Now, what do the kidneys do for you in terms of your body, how they help out with you? So, the kidney is located in the lower back region of your body. If you check, put your hand on your back, you see it right there. Two kidneys. And those two kidneys play a vital role in your body. What do? They help take out all the bad things in your body, either passing it through the urine or making sure those harmful products are passed out through your urine, or making sure the good products are absorbed by the tissues that need absorbing of those good things. So what does diabetes do to affect those kidneys? Diabetes, which is when there's increased sugar in your blood, it leads to overbearing of your kidneys, and that can cause damage to your blood vessels, which will stop the filtering of those bad things. When I say filtering of those bad things, I want you to assume a cone, and when you are pouring dirty water through that cone and making sure that clean water comes from under. Now, the kidney is that cone with the filter paper inside that will help take those bad substances and make sure that they pass through. While so if that look at diabetes as something that blocks that cone from letting the waste go out. So that is what diabetes does when it affects the kidneys. And when it affects the kidneys, it is typically called diabetic nephropathy. Now, these damages that it causes would lead to some other things. It would lead to increase of your blood pressure, because the small blood vessels in your kidney that help regulate your blood pressure, if they are damaged, your blood pressure will keep skyrocketing. Why? That's because your kidneys act like a bumper to how your blood flows. So let's say a car is going through a straight road, for instance. If it goes through that straight road without any bumper, the car will just keep flying through the road 60, 80 kilometers per hour. Now, what your kidney does is provide a bumper to make sure that when the blood is going through at that high pace, it can reach a position where it can go through that gallop, slow down, go through that gallop, slow down. So if you're driving your car and you're on a road with so many gallops, at the end of the day, the car will stop going at that high of a pace and try to go at a slower pace so that you'll be able to navigate those gallops easier. So that's what the kidney does. And if it is damaged, it is unable to do that, and the blood will keep going up and up. You would notice some symptoms when this occurs. Things like swelling in your legs, fatigue, difficulty concentrating, decreased appetite. You feel like whenever they put something on your body, you will not be able to feel it appropriately or tell what kind of thing is on your body. So these are the things that typically happen when diabetes affects your kidneys. So how do you know that your kidneys are affected? There are usually three pathways to know. We first have to do regular screening. What do we check? We check your blood. Why? So that we know whether those harmful substances that are meant to be moved away by the kidney are still in the blood. We check the urine to see whether those harmful substances that are meant to be removed are in the urine, and if there is anything that is needed by the body that somehow managed to find its way in the urine. And thirdly, we do a scan to check the condition of the kidneys structurally to see if it's actually affected in terms of how it looks at the back of your body. So typically, we do a test called a kidney function test to check the blood. Now, when you see that your kidneys are affected, you see harmful substances with increased numbers. Harmful substances in your body include things like urea or things like creatinine. If you see those things are increased, it means your kidneys are finding it difficult moving out harmful substances. Now, when you check your urine, if you see protein in your urine, that would mean that something that is useful for your body has managed to leak through your kidneys. Your kidneys has not been able to make them useful to your body. So you'd see what they call proteinuria. That is when protein is in your urine. Now, this proteinuria is especially difficult because when you see that in your urine, it typically means that your kidneys are not doing the required role for your body. And that would lead typically to what is called an end stage renal disease. Now, an end stage renal disease is when your kidneys are unable to function at all or function on their own without help. Things that are used to make sure that your kidneys will function is called dialysis. Now, what is dialysis? Dialysis is when your blood in your body is filtered out of your body through a machine to do the cleaning process of those toxic substances rather than your kidney. So when your blood is filtered out to this machine to clean, it is then returned to your body clean. So that dialysis acts as a sort of fake kidney or external kidney that would help clean out the toxic substances in your blood and then return it back. Now, end-stage renal disease is the finality. When we are talking here about the affection of diabetes to your kidneys, we also have to understand that it is not all doom and gloom and requires early screening. So once you catch it early, you can begin to counteract it, make sure that you battle it. And how can you do this? Lifestyle modifications is where you can start. Make sure you do your exercises, make sure that you are stress-free. Especially if you do 9 to 5 work, make sure that you get enough sleep. And also you should make sure that your diet is cleaned up in the sense that because you know you are likely or liable to have more sugar in your blood, you should make sure to eat more fruits, more vegetables, things that will give more fiber to your body so that your body is able to accept it being treated well by you. The link between diabetes and kidney disease is undeniable. It's a relationship that needs you to be proactive and make sure that you get ahead of it before it causes damage that it would be unsavory. Make sure that you do regular screening, reach out to your healthcare provider to make sure that you are in the right track when it comes to your treatment plan so that you can catch it before chronic kidney disease develops. Do this to preserve your overall health and well-being. I know this episode is a bit doom and gloom, but we have come to the end of it. If you have any inquiries to what we have spoken about today in this episode, please reach out to us. Thank you for tuning in to today's Seco Direct episode, and I'll see you next time. I remain your host, Dr. Tiwa. See you later.